The doctors are in, and it is my pleasure, like each and every week, I have Dr. Jaime King, over at Advanced Rockford Eye Care. Their address 695 North Perryville Road. And I'll tell you what, she's one of the best. Dr. King, how are you?
I'm great. How are you, Dean?
I am well, thank you. All right, I'm going to ask you a little bit of an odd question just to start this interview, Dr. King. Okay. I just had Dr. Bales on, and we were talking about nutrition for heart healthy, that it's important. Mm-hmm. I go to your website, mm-hmm. and I was surprised. You got a great website, by the way,
yeah.
And I recommend everybody go to that. But one of the things that are on your website, and I hope I'm doing the right thing. I never know what legally I should be doing or not doing, and I don't want to put you in a bad spot. But you also have USANA products,
yes.
Which is kind of interesting to me. Dr. Bales was just saying the same thing. How important is nutrition for your eye health?
Well, that's interesting, Dean, because what's been going on is, and we've talked about this before, when I look at the eye and I dilate the eye and do a comprehensive eye exam, we see so many things within the eye that systemically are going on somewhere else. We see high blood pressure, we see high cholesterol, diabetes, all sorts of things. And there's a lot of degenerative eye diseases as well as systemic things that go on in the body that are caused by just not consuming the appropriate nutrition or not getting the right nutrition in the body. A lot of things that can be avoided in the eye and other places in the body that could easily be avoided with the appropriate nutrition. And, there's a lot of vitamins that we've been taught to prescribe for eye health, and learning more and more about how these nutritional supplements and over-the-counter vitamins are not regulated by the FDA. As a physician, you try to look for things that are safe for your patients to take and that you're comfortable recommending.
Mm-hmm.
USANA really is the only one that I've found. It's what I take. It's what my family takes. It's what I recommend to my patients.
And I want to make sure, I want to make this very clear. Dr. King, when you went to become a doctor, you weren't looking to sell USANA products. I mean, so this is like an added thing that you found that it's a good thing, but your overall concern is for your patients and eye care.
It is, and we have a hard time. I think doctors have a hard time recommending a particular vitamin, but it's a disadvantage and a disservice if I know that there's something good out there
mm-hmm.
taking to not share that and recommend that for my patients as well.
Wow. Okay.
My sister's a pharmacist.
Yeah.
We talk about this back and forth, and she has said the same thing. You see, on her side of it, she sees patients coming up asking about vitamins that they're seeing over the counter. And the label may be on there saying that, X, Y, and Z is within that bottle, but the government does not regulate that that's actually what's in there. Oftentimes, even that, if that's what's in the vitamin packaged within that,
mm-hmm.
there's no guarantee that it's in a form your body can absorb.
Wow.
So, these are scary.
Yeah, it is scary.
People don't know about.
Dr. King, that brings me to, where I want to go with this. I mean, I come, as you go into your office and you see all these designer glasses and you see all these wonderful things, and, people sell the type of glass everywhere. It's brands that, you can get at a lot of different places. One of the things that struck me with your clinic is that they are actually getting you as the doctor, that you take care of the eye, you really look overall through, you dilate, you do all these other things, and it's important that people know you're not just going there to pick out a real pretty frame. Mm-hmm. You're there to get that doctor that's going to be able to tell you if there's going to be a problem going on. That's what I see with you, Dr. King. And I don't mean to, I hope I'm not embarrassing you. I'm just just stating a fact that, you are there to look and take care of people. And it's very, very important, that people, think about this before they go. I know sometimes you see or hear these ads where you buy 15 pair of frames and you get 24 more free or whatever. I mean, it's always some deal, you know. But with you, it's, you know, you've got you as the physician there to take care of these folks. And you've seen a lot of different, and a lot of great places around. So I don't want to not say that, but it's important that you keep the same doctor every time you go in. At least that's what I think. What are your thoughts?
Well, it's certainly better for the patient. You know, we can keep updates, and we have baseline things, imaging that we use for the retina, so we can follow with them from year to year. It's also important when we're co-managing with doctors of other specialties, which we do a lot of here. Not only do I co-manage with ophthalmologists when patients require surgery, but I'm also corresponding with their primary care doctors or doctors of other specialties, especially with patients with diabetes or high blood pressure, corresponding that information to their primary care doctors. But it makes it easier to stay with the doctor you know and a doctor
right.
you should trust.
And by the way, for all parents, Illinois state law mandates that you give an eye exam for all children entering kindergarten, correct?
Right.
Okay. And you're taking appointments now for children's eye exams?
We are, and we're actually within the last week, we've already seen quite a bit of back-to-school exams already. A lot of parents trying to get that in early before the rush of back to school.
By the way, for children, they have Disney, Barbie, and Converse frames.
Mm-hmm.
Now, my Barbie frames, they rock. I just want you to know that. People are noticing because people are going, nice frames, Dean. Thank you. Very nice. That's very cool. You know, so we do encourage everyone to, you know, get over there, make an appointment. And again, you're looking for potential eye problems and also, you know, my grandson needed glasses at age 4. I don't know how, is that younger side, or have you had younger ones, or?
I've put infants in glasses.
Wow.
I mean, usually we start around the age of 2.
Okay.
But sometimes we have pediatricians that may send them in a little sooner, and there are some babies that need glasses, so we have glasses as small as for infants.
Wow. That is amazing.
Yeah.
You know, and again, don't forget, if your children is going, you know, they're getting ready to go to school, that if they're having problems with vision, that could be, you know, learning disability. I mean, it's a lot of things, poor grades. I'm thinking I got ripped as a child. Maybe that was my problem.
Well,
Dr. King, maybe my eyes were bad.
Because we're only the 3rd state to recommend this or mandate this for children in kindergarten, which is a good thing. That's a great thing. But the thing is that really parents shouldn't be just thinking about this for kindergarten.
Right.
The eyes are constantly changing. This is something that should be evaluated every year. Even parents who stay on top of the yearly exams will see a child one year, and the next within that same year, the prescriptions changed quite a bit because they're growing and they're changing a lot. So certainly, kids aren't always going to tell you, Mom, it's blurry, I can't see the board, or I have headaches, I can't read.
Mm-hmm.
They don't really know how to explain that when they don't know what clear is. So to just stay on top of that and make sure, we like to tell patients and parents that really it's the most important back-to-school supply.
Absolutely. And you are taking, right now, appointments for that. Mm-hmm. All right. And if you've not been to a doctor, please just call and make an appointment, and you'll be very, very satisfied. I guarantee it. Dr. Jaime King at 695 North Perryville Road. You know, she'll help you look and see better. That's what she does. Dr. King, good to be with you.
Thank you. It was a pleasure.
I was going to stretch longer, but I know you got to get out and run. What do you run, about 25 miles a night or something?
Almost.
Yeah. I know you're a runner. You know, as a matter of fact, when you were telling me how much you ran, I normally drive that far in my car and I get tired. So, you know, otherwise, I'm a fat guy, but I don't sweat much. What's that?
You should start running with us.
Yeah, that's a good idea. You want to hear somebody whining and crying in their Barbie glasses? It would be me. So, Dr. King, as always, I'll see you next Wednesday.
Okay, thanks so much.
You notice how I put that, I'll see you?
Mm-hmm.
Very nice, huh?
I like that.
It was just for your, I think that was very clever on my part.
I appreciate it.
All right. Thanks, Dr. King.
Bye-bye.
All right, bye now. She is wonderful. We're going to take a quick break, And I am looking so forward in just a minute. One of my favorite people in the world, Tracy, and her butler, also here, Brad. And so I can't wait for them to be here in just a minute. The doctors are in.